So we have 2 bladder cancer patients, survivors, what we might call you. Keith Bell is going to join us this evening. So Keith, we know Keith well with Bladder Cancer Canada. And we have Shristi Jane. Are you here? Here she is. And then we have our own Stephen Andrew. So I'm not going to begin to try to introduce these people. I think I'd just like for each one of them to spend a couple of minutes just sharing, 2 to 3 minutes, just sharing their story as it relates to their bladder or their kidney cancer, and then maybe just a quick little tidbit about yourself, about going forward with some of these tips is what you like to do for a hobby, or what you really enjoy, or what sort of makes your clock tick. How does that sound? Do you want to start off, Keith?
Okay, sure. My name's Keith. I was diagnosed with bladder cancer just about 2 years ago, September 2015. I had 3 TURPs over a year and a half just to determine the stage. And finally, this past August 21st, had radical cystectomy, and I now have a neobladder. I've been through all the nutritional stuff. I exercised. I did a lot of research to figure out what kind of muscles I was going to have to need after surgery, and I worked with a kinesiologist in a cancer supported exercise program prior to my surgery, and that really was a big benefit and helped my recovery remarkably after surgery, which is why I'm sitting here. Can't wait to get back at all my activities that I used to do, like golf and squash and racing my go-kart, which I'm going to start doing again in the new year. So, yeah.
That's awesome. Thank
pass
you.
It on.
Okay, Shristi. Well deserved. Thank you.
My name is Shristi. I moved to Canada about 17 years ago. I have 2 daughters, 19 and 14. I was diagnosed with bladder cancer last year in October. I had a TURP, and then another one in December, 3 months later. Then 6 months later, I had a round of BCG for 6 weeks, and then another round for 3 weeks. So I've had my first anniversary of all clear this year. Yay! Yeah. So I just like to say that I think cancer has like a stigma attached to it. Like the past year, it hasn't been so bad. Like all my friends and family always, the best part is your friends and family always return your phone calls. So, yeah.
That's awesome. Thank you. Thank you.
Thank you. Well, kidney cancer patients know about my story, but just very quickly for the bladder cancer patients, I was diagnosed with metastatic disease in 2006 after I was actually reading the 11 o'clock news on CTV in Victoria, and you take a bathroom break very quickly before you get in the chair because you have to get wired up and everything. So, you have to sit there for sometimes uncomfortable time if you have to dash between commercial breaks and stuff like that. But I was peeing in the urinal and saw that someone had dumped coffee grinds in the urinal. So I thought, and so I had to stop peeing and then flush them down because you can't pee in a dirty urinal. That was my thought at the time, I think. And I saw them again. And this time, if anyone had walked into the washroom at that time, they would have seen me with my head stuck in the urinal, tapping these little things. And of course, I discovered they were blood. So they took my kidney out in 2006. A couple of months later, they took a part of my lung out. Then I had metastatic disease all the way through my lungs. I went on sunitinib, and then we found a lesion on my spine. That was handled with regular radiation. When it didn't respond, I took stereotactic radiation through a trial in Toronto. I was on sunitinib for, Sutent is, you may have heard, for about 4.5 to 5 years, and the tumors did shrink, so much so that actually they couldn't see them. So I came off the drug without telling my oncologist, and he ribs me about that to this day, as you know, if you're in the other forum. And I am very happy to say that I'm 6.5 years now, no evidence of disease. So there's hope. You asked about our lives and what we do. I think one of the things that I do now is I live my life. I have to tell you that. It's, I actually get quite emotional about it when I think about it, because all those years that I went around living my life, not realizing how wonderful life was and how wonderful my friends and family were. And then when you get a disease such as this, it changes your vision. You walk outside and, nothing is taken for granted. And I've now seen things that I've never seen. One of my joys in life from years and years ago was I always wanted to go to Broadway and see a Broadway show. We go every year now. It is fulfilling. And I just want to make a note that Phil brought up in his presentation. The work of the Kidney Cancer Research Network of Canada and those priorities. One was the issued no decision guide. There is now, I have just released a metastatic decision guide that's available worldwide. And Kidney Cancer Canada is working with the International Kidney Cancer Coalition to develop a early stage guide as well. So those tools are there, and if you want it, just see me afterwards, and I'll make sure that you do get a copy. It's very important.
Thanks so much. So at this point, so we've heard from three people. We're going to open up the floor, and do you have questions for any of these people? Does anyone have a question they want to ask about, what they've experienced or what they've gone through, or anybody from the audience want to start a discussion? Or no, we're all tired. Well, and it's hearing from people like yourselves that you're in the same, you've been there, you've done that, and they've been there, and you know that everybody in this room is connected to either bladder cancer or kidney cancer, and we all need to make sure we're keeping in touch tonight and after tonight, and staying connected and working on our respective causes. And I think just hearing these stories here tonight is a true example of what sticking together and what working together can mean for patients, and the work that we can do to elevate our cause, so that we become as recognized as some of those other groups. So I don't know if any other last minute questions, comments. Ken?
I wonder if any one of you would like to comment on the relationship that you develop between yourself and the doctor who's treating your cancer for you. And in the sense that very often I hear from patients that, well, my doctor doesn't tell me anything, or they don't really explain it, and I haven't wanted to ask them. And no, I never see a copy of my pathology. I've never seen a pathology report. I don't even know what it is. And I wonder if you have any counsel or advice for people from your experiences as more of the proactive patient that you all seem to be, about ways in which one can take a little more control over what's going on in their life in terms of the relationship with the medical side.
Fine. I'd be happy to comment on that. What was really important for me was to do my own research. I mentioned that I had 3 different TURPs resections. That was with 3 different urologists in 3 different hospitals. And after the first one, I was not happy, so I wanted to seek a second opinion. And I always took responsibility for my health. Well, I've done that my whole life. So, and it was really important for me to make my own decision. I didn't make a decision to have the surgery until until this past spring. And I was really sitting on the fence as to whether to have it or not. But when I did decide to have it, it was my decision. It wasn't that somebody was telling me I had to have it, which I think really kind of puts you in a victim situation rather than determining for yourself what you decide to do. And I know that once I made the decision that I was going to have it, then my competitive spirit came in and said, I'm going to do it better than anybody else. And that's really what moved me through to do my own research, to continually search for more and more information on the best way to do that, what I could do prior to surgery, that would benefit me coming out of surgery, I've always been into physical fitness. I knew that was an important part of it. And I knew if I could build muscle memory into the muscles that I was going to have to use after, it would really benefit and speed up my recovery. And that was exactly the case. You know, in my case, coming out of radical cystectomy with a neobladder, I mean, there was once I was clear of all the tubes and pegs, you know, there was a 4-week self-cathing schedule, which I was facing, and I managed to breeze through that in 5 days, simply because I had done all the exercises ahead of time and I knew exactly what I had to do. So I think that's really, I would really recommend that anybody, you know, facing this, really do their own research. Don't be afraid to get a second opinion. And if you're not happy, get a third opinion. And make your own decisions for yourself as far as your treatment goes.
I'm just going to add a bit of that and for any doctors listening online, as this gets rebroadcast, please turn off your computers now. All doctors are not created equal, and the doctors that you've seen come here tonight, that come to our events time and time again, are connected, and the healthcare professionals, they are connected, they want to make a difference. And I will tell you that my first oncologist, I was not happy. I felt I wasn't being listened to. And my partner said at the time, after one event, because he can be overly dramatic, Stephen, I want you to get a second opinion because this woman's going to kill you. And it was a bit of a joke too, I think. But I did change, and I ended up with Kristen Coleman'sberger. And I can tell you that I felt so much more comfortable with the relationship. And at Kidney Cancer Canada, and I know Bladder Cancer Canada has the same opinion, the patient voice needs to be involved in the treatment. You need to be consulted. Because Phil says, if you are an informed patient, it can make significant changes in the outcome to your treatment options. And I hope that's what kind of Ken is kind of trying to get across. If you have doubts, get in touch with someone. Call peer support, call our organizations. We will help you, put you in connection with different people that can help. But please do not sit there alone wondering what if. If you're feeling that at any point in your treatment options, remember, it's your life. You have control over it, and it's very important.
Okay, thank you so much. Any other final comments or questions from our panel?
Go live your life and tell everybody. Tell everybody about tonight. Please do that.